My name is Dr. Caceres. This is the Enhanced External Counterpulsation Therapy at Buena Heart Center. We are here with one of our patients, Mr. Eecp. Mr. Eecp had coronary artery bypass graft surgery a few years ago. Despite medical therapy, he continued having episodes of substernal chest discomfort associated with shortness of breath. This is what is called angina. In patients who had already bypass surgery or angioplasty of the coronary arteries, and despite medical therapy, they still have chest discomfort or symptoms of what we call similar to angina, equivalent angina pectoris, then enhanced external counterpulsation is indicated. Basically, as you can see here, we have 3 pneumatic cuffs, 2 around the legs, 2 around the thighs, and 2 wrapped around the lower buttocks. The inflation and deflation of the pneumatic cuffs work in synchrony with every heartbeat. So the inflation of the pneumatic cuffs takes place during diastole. Start here, the inflation in the legs. 50 milliseconds later, the inflation is in the thighs, and then 50 milliseconds later in the lower buttocks. That creates the blood pressure going up, the blood toward the coronary arteries during diastole, increase the pressure in the coronary arteries and also the blood flow to the coronary arteries. During systole, when the heart contracts during systole, then these pneumatic cuffs simultaneously deflated. So you have inflation and deflation of the pneumatic cuffs simultaneously with the contraction and relaxation of the heart. Also, the patient has this, the pressure wave is measured to the plethysmographer. We have here Samantha, one of the Eecp therapists, and this is a comfortable bed where the patient received the enhanced external counterpulsation therapy, usually 1 hour a day, Monday to Friday for 35 sessions, as has been approved by Medicare since 1999. Steve, how do you feel?
I feel real good.
Okay. So tell us about it. How you were feeling before and after the therapy? What do you think about the therapy? Are you feeling okay? Are you uncomfortable or?
I'm very comfortable right now.
Very comfortable. Okay. Okay. So what has been your experience with the enhanced external counterpulsation therapy?
I will have the therapy, and as the months go by, I seem to feel like I slow down a bit, not as much energy, and then I'll have my therapy, and I feel like I'm getting my energy back as I am right now. You know, before I started this about 3 weeks ago, I was getting a little run down, tired, and I'm getting some energy back. I'm feeling better physically. I'm feeling a little bit better mentally about myself.
Have you had more episodes of chest discomfort or shortness of breath since you started therapy? Has you noticed that have helped you in?
No, I haven't been having problems.
Yeah.
Doing pretty good.
No more angina pectoris with the therapy?
No, not at all.
Very good. Yeah. That's what of the benefits of the therapy that helps the circulation in the coronary arteries, the arteries who supply blood to the heart, but also creates new small vessels in the heart muscles and improve the circulation not only in the heart, but also in the brain and the kidneys, the lungs, and other areas of the body, organs, tissues, and cells of the body. Samantha, how long have you been doing Eecp therapy?
I'm working here already for 4 years, and a lot of patients are telling us without even asking that there's a lot of improvement. And how this therapy works It's we wrap the lower the calf and put 2 inches so that we don't hurt the knee, and you make it assure that the patients are comfortable, and don't put it too tight if the patient is already they're just starting. And some patients says that this therapy helps them to decrease the intake of blood pressure medication, and they give more energy, and it lessens their angina pectoris. This is a plethysmograph. We put it on the patient's finger to monitor the blood flow, oxygen to the pressure. And there's a machine right here where we see the results, if they're an improvement, the blood flow, circulation.
Also, they start using less medications than before, and improve their sleep, improve the sexual dysfunction, no more lower back pain, and that's just one of the other benefits that come along with this kind of therapy. This therapy is unique and doesn't have any side effects.
This one, we let the patient wear the pants just to avoid the skin irritation, and it's like we can describe it as passive exercise.
Like passive exercise, very good. Okay, Steve, well, thank you very much. Thank you. Hi, my name is Dr. Caceres. I'm a cardiologist for more than 30 years in the States. Today, I would like to briefly talk to you about the killer number 1 in the United States, coronary heart disease. Heart disease is the leading cause of death for both men and women. Coronary heart disease, this is the hardening of the coronary arteries, is the most common type of heart disease, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. In the United States, someone has a heart attack every 43 seconds, and each minute someone dies from a heart disease-related event. Your heart is about the size of your fist, like in this heart model. The coronary arteries are the blood vessels in top of the heart, and they are the ones who supply the heart muscle with oxygen and nutrients. Basically, there are 3 main coronary arteries. One that goes in front of the heart, between the right and the left ventricle. The another to the right side of the heart, between the upper and the lower chamber on the right. And the another artery, the circumflex, that goes around the heart between the left upper chamber and the left lower chamber. 3 main arteries in the heart. Now, coronary artery disease is the hardening of the coronary arteries over the years as a result of high cholesterol, hypercholesterolemia, high blood pressure, hypertension, high blood sugar, diabetes, smoking, family history, and other factors. So the normal coronary arteries looks like something like this, with the lumen open, completely open. Over the years, we will have a gradual narrowing of the coronary arteries. In these slides, you can see the normal coronary artery here. This is the lumen of the coronary artery normal. Over the years, because of those risk factors, there is inflammation of these arteries with the development of plaques, deposits of plaques, leading to narrowing of the lumen of these coronary arteries, like in this case of severe atherosclerosis. This is the way that the coronary arteries looks like in the coronary angiogram. This gentleman is a 68-year-old male who has hypertension, high cholesterol, and diabetes, and over the years developed coronary artery disease. You can see in the arteries already mentioned, you have severe stenosis of the left main, severe narrowing of the circumflex and the branches, and also in the left anterior descending coronary artery. What are the symptoms of coronary artery disease? It goes in the spectrum from no symptoms to sudden death. Many patients, like those who have diabetes mellitus, they may not have any symptoms at all. No symptoms. Others may have chest discomfort, angina pectoris, shortness of breath, indigestion, heart attack, or sudden death. The treatment of coronary artery disease involves the use of medications, angioplasty with a stent, coronary artery bypass grafting, or enhanced external counterpulsation. In this slide, we have a diagram how the coronary angioplasty is performed. This is the coronary artery with a severe narrowing. A guide wire with a deflated balloon is passed through the catheter in the narrow artery. The balloon is then inflated to open the narrow artery, and the stent expands around the balloon. The balloon then is removed, and the stent is left in place to keep the artery open. That is the coronary angioplasty with a stent. The another way to treat coronary artery disease is coronary artery bypass grafting or coronary artery bypass graft surgery. By using the internal mammary artery, like in this case the left internal mammary artery has been grafted to the left anterior descending coronary artery after the site of the narrowing or the blockage, or the surgeon use the saphenous veins of the lower extremities of the patients. So this saphenous vein graft goes from the aorta to the coronary artery, the right coronary artery in this case, bypassing the blockage. And the another form of therapy, this is a unique non-invasive therapy, is the enhanced external counterpulsation, or Eecp for short. In the Eecp, pneumatic cuffs resembling oversized blood pressure cuffs are wrapped around the calves, the lower thighs, and the upper thighs, including the buttocks. Inflation and deflation of these pneumatic cuffs is timed to the patient's heartbeats and the electrocardiogram, while the arterial pressure waveform is monitored by placing a device in the fingers of the patient, one of the fingers of the patient. So inflation takes place after each heartbeat during diastole. There is sequential inflation of the pneumatic cuffs from the legs to the thighs to the lower buttocks. This inflation pushes the blood back to the heart, open the coronary arteries, increase the blood supply to the coronary arteries and the pressure in the coronary arteries. At the same time, open small passages, small narrows, small arteries that we cannot see with the naked eye. Deflation occurs before the next heartbeat during systole, before the contraction of the heart, and the deflation is simultaneously in the legs, thighs, and lower buttocks, and that deflation facilitates the cardiac unloading. In this slide, on the left you have a patient who don't have counterpulsation, and on the right a patient who had counter pulsation. This is the electrocardiogram, the blood pressure waveform, and the inflation-deflation valves control signal. Notice that during diastole there is diastolic augmentation, which means increased blood flow into the coronary arteries and the pressure of these coronary arteries. This slide summarizes some of the benefits of the Eecp. Increases the amount of blood ejected by the heart in 1 minute, that's the cardiac output. So there is more blood coming into the heart, in the right side of the heart. Increases the blood flow to the coronary arteries and oxygen delivery and nutrients to the heart muscle. Decrease the peripheral vascular resistance, which increases the cardiac output, meaning the blood ejected by the heart in 1 minute. Also, Eecp promotes the development of new functional collateral vessels in the heart muscles. Eecp is indicated, therefore, for patients with coronary artery disease or heart failure. Eecp is prescribed by a cardiologist or a cardiovascular surgeon in patients who had symptoms of coronary artery disease or who are not candidates for coronary artery bypass graft surgery or angioplasty, or in those patients who, despite of having bypass surgery and or angioplasty with or without stent, they still have symptoms of angina pectoris or equivalent angina pectoris symptoms. So the therapy is usually given for 1 hour, 5 days a week, Monday to Friday, for 7 weeks, for a total of 35 treatments. This therapy was approved by Medicare in 1999, and of course is covered by Medicare and most of the healthcare plans. At Buena Heart Center, we have more than 8 years experience with Eecp. We have helped more than 600 patients with this unique therapy, and we are committed to provide this effective therapy which brings many benefits to all our patients with hardening of the coronary arteries and heart failure. In summary, Eecp is effective and safe treatment for patients with coronary artery disease and or heart failure. Eecp is an alternative therapy to coronary angioplasty with a stent or coronary bypass grafting surgery. And Eecp reduces the symptoms of angina, use of medications, increases energy and exercise tolerance. Thank you. If you are interested in receiving a therapy of Eecp, you are welcome to come to Buena Heart Center. We can give you a therapy session for you so you can see the effects of this therapy. Again, this therapy is a unique, non-invasive form of treatment for coronary artery disease for those patients who have angina or similar symptoms, or patients who already have procedures such as angioplasty or surgery and still are symptomatic with coronary artery disease or have heart failure.